What's going on, guys? Welcome back. Tony Maritato here again. Let's take a look at the next question on the list. May I use my involved arm for dressing, bathing, driving, and other daily activities? How should I manage my arm in the shower? They're saying that you may use your own wrist, hand, and elbow for daily activities. These include eating, shaving, dressing, as long as you do not move your operated arm away from your body and it does not increase your pain. Don't use your arm to push off or push up from a bed or a chair for 6 weeks following surgery. When using your keyboard or mouse, do not move your arm away from your body. When showering, you may wash under the involved armpit by bending forward to let the arm hang freely and reaching underneath with the opposite hand. Do not actively move your arm away from your body. So this is just kind of reiterating. I think it's a little bit confusing the way they have it laid out here, so let me kind of explain a little better. For the first 4 to 6 weeks, depending on which is the surgical side, you're basically not allowed to use that arm for just about anything, especially anything that's away from the body. Now, if you did not have the biceps tenodesis procedure done, if your surgeon said, yes, you are allowed to actively flex and extend your elbow, then there is a little bit of stuff that you can start doing. Most of the time, we're gonna have you in therapy start working on wrist flexion extension. You're certainly allowed to do any kind of squeezing, grasping with the hand. That's gonna help keep some of the fluid out of your hand. One of the things that you're gonna find is with the shoulder in this down dependent position, your fingers, your hand, your upper extremity is gonna feel swollen and tight. So any kind of self-massage, compressing, squeezing the fingers with the non-surgical hand is going to help move some of that fluid back out into the system. We don't want you to use the hand to push up from a desk, to push up from a chair. Again, you should be in that protective sling for 4 to 6 weeks. There should be that abduction pillow, that cushion that kind of gives you some space between your body and the forearm. Part of the purpose of that pillow is to improve the blood flow and the circulation through the shoulder. If that pillow, that cushion is causing you more pain, more limitation, you can talk to your surgical team to see if maybe you would be appropriate to remove it. But typically in the sling, 4 to 6 weeks, no functional use of the upper extremity. Now, if you're right hand dominant and you had a right rotator cuff repair, there may be certain things that you have to do. You might have to write, you might have to sign your name, sign a check, do things like that. You're allowed to do some of those things within reason, as long as you follow these guidelines, which again means you're not allowed to lift the elbow arm away from the body. You're not allowed to lift or carry anything with the surgical arm for 4 to 6 weeks. And we want to try and limit how much that you're doing. Some people like to do knitting or crafting. Some of that is fine as long as you can protect the surgical site. Guys, catch me in the next video. We're going to answer the next question.